What is up, everybody? DanDanTheFireman here. Today we're doing something slightly different. We're going to be going over the crash after action review, and then we're going to go over the medical portion. So I will have timestamps, but I just want to say thank you so much to Cardo for sponsoring content like this, and I'll talk more about them a little bit later. But let's go ahead and move into this part right here. So we're riding, we're with a group of friends, and this says 35, we're going 99. I don't care if it's kilometers, I don't care if it's miles per hour, it's still going to be quite a bit. So just realize what we're doing here. So I believe she actually slowed it down, did slow look, press and roll before this turn. We can't really know because it cuts out right here. But the main thing that happens is this part right here. So we're looking away from the road. We talk about vision all the time. We talk about line of sight. We talk about where you need to look. We talk about, yellow stage, orange stage, all these different things zoning into what is pertinent. So what is very important, and looking in front of you, especially right after a turn, is very important, okay? So what happened here? Why are we looking off? We're thinking maybe we're looking off at the beautiful lake over there, but no, in reality, what happened was she says she's turning to see where her riding buddies were. I felt the camber of the road change all of a sudden down towards the gutter, and all my weight was on that side of the bike. By the time I turned back around, the bike was in line with the gutter, which was very deep, and I couldn't pull back out on the road. Worst part, it wasn't even my bike. So that's not a good situation. So what really happened? So the camber of the road. So the camber of the road can be pretty much, left or right or just nice and flat. So what happened here is it kind of pushed her out towards the outside because the road was situated that way. Typically, it's going to be for drainage, so you got to be very careful with that. So this is why you always need to be paying attention until you're going straight, and then you can maybe look around. But one thing that I really want to bring up, and this goes back to Cardo, is that you have a Bluetooth system. So that way you're able to communicate with your friends or your riding buddies. So you're not having to look everywhere. That way you can keep your eyes on the road and just speak. And one thing I really like about the Cardo Pack Talk Bolds and the Slims and everything that we use here at DanDanTheFireman is that it has that mesh system. So even if you disconnect or you go too far, if you slow down and they get close to you, it reconnects and you guys can communicate. So it's really cool to have. We have a discount in the description, so please check it out. Also, we have a bunch of other resources in the description, like my second channel where I go over all the training that we do here. I just do AARs on this channel. All the on-bike stuff is on the second channel, so check them all out. Anyways, we're gonna be moving forward a little bit more, and as soon as we realize, oh crap, what's gonna happen here? And that's where that drainage kind of goes off to the side of the road. They have it right there on purpose. So we're gonna hit that gutter, and there's not much we can do. This is almost like hitting the train tracks or a tram rail, like the rails on the ground inside of a city. So this is one of those things that you don't wanna be in. If you find yourself in it, you gotta get yourself out of there as quick as you can by turning those bars and trying to hop back out. It's very difficult. By the time you get into that situation, hopefully you have full gear because something like this is going to happen, okay? So that's not a good situation. So what really could we do before this? Main thing is, what is important when we're riding, okay? Is our buddies behind us important? Yes, they really are. But what's more important? You're more important than your friends. Remember, if they get in a crash, it's their emergency. If you get in a crash, it's your emergency. If they get in a crash, you can take care of them. If you get in a crash, hopefully somebody can take care of you. So when I think of that, I don't want other people hurt, but the thing is, I don't want to get hurt because I know I have the skills to take care of other people when it comes to a medical emergency or a trauma emergency. So when it comes to this and I'm looking back and doing all these things, I'm keeping my eyes off of what's really important, which is going to keep me alive, which is going to keep me safe. So keep looking forward. Vision's very important. If you get distracted because your friends aren't around you or you can't see them, that's where having a Bluetooth system will mitigate that problem. It'll actually solve a lot of your problems when it comes to that. So this is where we need to get into that. If you start to feel these things, remember, you also have to get really into it. You have to be aggressive with your positioning, your location of hazards. You need to adapt to things. But then right here, this is that negotiation of a threat, which is going to be the wall and the gutter. So remember to plan your ride. We talk about that on the second channel. But anyways, that is how I would fix this problem. That's how I would solve that. This was just a simple mistake, so there's not really much we can really go on. But here's the thing. I'm going to go talk about the medical AAR portion, and let's figure out what happened to her after the crash.
What, you all right?
I'm a volley with the brigade around here, so
oh, great,
how
thank
are
you.
you guys feeling? All right?
Oh, so you've come off. So what's sore?
How old are you then, Eddie?
Good.
How old are you?
How old are you? 30.
Thanks, mate. Appreciate it.
Yeah.
Yep, thank you.
Thank you.
Yeah, we're fine. Ambulance is on the way. Okay, thank you. Yeah, thanks, mate. No, we're good, thank you.
And you're not allergic to any medications?
No medications, no. No.
Ambulance is heading this
Push
way.
analyze. Connect electrode.
Yeah, no, that's where roughly the spleen is.
Yeah,
and that's
right.
always we have to worry about.
Couple bumps. I'll try and make it as smooth as possible. And you get to see good old days. On YouTube.
Okay.
I'm going to roll you toward me.
Yep.
A hard board's going to go under you, and I'm going to slide you over to the other board.
So this right here is when you start to pull up onto a friend that might have crashed, or if you're just riding with some buddies and you see a car crash or some stranger crashing on the side. This is where you can actually do your scene size up. This is where you actually figure out, okay, how many people are here? Is it safe for me to stop? You know, what kind of resources do I need? Do I need to make sure I get my gloves? Do I need it? That's when you start going through that process and you start to learn all that stuff through medical training, bystander assistance training, which, guys, remember, links are in the description for all the stuff I talk about, all the training, all the resources. So this is where I start to look and I'm like, okay, she's obviously not standing up. Typically after a crash, some people stand up and are like, oh man, this sucks. She's not doing that. So if I'm riding with her and I know who she is, and I know that she's not, or she's typically the person that stands up and jolly, and all of a sudden her demeanor changes, there's something going on there. Just real quick, I want you guys to understand, and I don't want anybody in the comments saying, well, why didn't this rider rush and hurry up? Here's the thing. You got to start going through that process, figuring out, detach yourself from the emergency so you can actually be a leader, so you can actually see what needs to be done and take care of it. Have somebody that will do it, have somebody that will get a little concerned and run at it like this person right here, and that's fine. You're going to sit in the back with the most training and figure things out. But let's go ahead and listen to the assessment.
Okay, stay here. What happened, Jack?
What happened? I don't know. Okay, so that right there is going to be that jostling of the brain inside the skull. And right here, this is what she said. She said on December 27th, 2019, concussion from hitting the bank, fractured ribs, grade 5, spleen laceration that exploded on impact, lost 2 liters of blood, so off to the hospital, emergency surgery to get it removed with a blood transfusion, 25 staples. I spent a week in the hospital over New Year's and still at home recovering. This was a while ago, so hopefully she's doing better. But thank goodness for insurance, accident coverage of their health system. So guys, this is one of those things that, you know, it's pretty bad. You know, thankfully there was some resources to help her out. But remember, here's the thing: fractured ribs, grade 5 spleen laceration that pretty much exploded, a lot of internal bleeding, and then had to get it removed. So she had a splenectomy. And what happens there? What does the spleen do, basically? So the spleen, it's a filter organ that filters out any toxins, maybe some bacteria, anything that could be dead tissue, you know, like red blood cells that have died off, or white blood cells, all those different things. And when you remove it, your liver and a few other organs will actually take up that job, which is amazing what the human body can do. But the worst part about all of that is that now you have one less filter, so there could be a chance of a higher infection rate for something else. So losing your spleen is not good, but your body is amazing. So just realize that she also talked about having a lot of internal bleeding. You'll bleed out a lot. She had a grade 5 spleen laceration, and that's the worst spleen laceration. So basically what happens, it just completely exploded inside of her body, and that's why she has a lot of internal bleeding. But let's go ahead and go over a little bit more. I just wanted to tell you guys that.
Do we need to call an ambulance? No.
At that point, go ahead. Just call an ambulance. You can always refuse service.
Hi guys, my name's Anita.
Hi.
I'm a volley with the brigade around here,
So she's a volunteer with the brigade. I'm assuming that is a fire department. So she's a volunteer firefighter or volunteer EMT, EMS, whatever it is they have over there for certifications. Perfect. We have somebody on scene that knows what they're doing. They can take command, they can take charge, and then direct resources where needed. And that could be you with some medical training.
Oh, great.
How are
Thank
you
you.
guys feeling? All right.
Oh,
So you come off.
Just right here, what I see is that there's guarding on the left side, and your spleen is on your left side underneath your ribs. So when I see her doing this, that right there tells me, uh-oh, there's something going on in this general area. If you do this, you know, you're probably not hurting anywhere, but if all of a sudden you're doing this, that's called guarding, and you're trying to hold that, you're trying to protect it even further from injury. So that is my main concern. She's not protecting her legs, she's not protecting her head, she's not holding her neck up, she's not saying her back hurts and she's wanting to lay down. What she's doing is like, ow, 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 here. So it could be an arm injury, or it could be internal injuries. So either way, that kind of directs you where you need to go. Don't get distracted, still do a full assessment.
So what sore?
How old are you then, lady? How old are you?
How old are you? 30.
So that's very telling of a concussion. How old are you? Having to ask that question, having a blank, having a, uh-oh, what's going on? How old am I? So I typically have that problem just because I don't pay attention to my age, but I have a general understanding and I'm not struggling to figure out what's my age. So that right there, there's a brain something. The fact that she's able to be mobile and she's able to do things, it means that it's not the severe brain injury. But here's the thing, a traumatic brain injury could be just a simple concussion all the way to your brain outside of your skull. So she still has a traumatic brain injury. Okay, there was trauma that induced it. So when we see this and that the fact that she can't remember, note the time, note what happened, note what was the question, what she said, ask that same question in 5 to 10 minutes, and if it's the same type of answer, we're still in this bad situation. If it's a better answer, like right away she answers it or answers it quickly, then we have more of a trending towards progress. If it gets worse and worse and worse, we have other issues. So this is a brain problem. If there is a brain problem, like you can't understand, don't just assume, oh, it's just a simple concussion. You can also assume the worst and say, you know what, we do need to go to the hospital. We do need to get a CT scan. We do need to do these things because you can't remember stuff that you typically could. And we don't know if there's a bleed. We don't know if there's a contusion, which is the same thing. But we don't know what's going on when it comes to the brain without the testing procedures done at the hospital.
Thanks, mate. Appreciate it. Yep, thank you.
So you're going to have people coming up to the scenes and they're going to ask if you need any help and all these different things. If you come up to a scene and you see a bike on the ground, you don't have to stop. Just ask, hey, is everything fine? Is everything okay? I'm a medical personnel. I know medical stuff. Is there anything you guys need help on? Would you like my assistance? And if they're saying, no, you're good, just keep going. It's not your emergency. Obviously, they feel like they have it handled. You don't have to do an assessment. If you feel even more convinced that, you know, things are not being handled, just pull over and just ask your own question, then leave if you want.
Thank you.
Yeah, we're fine. Ambulance is on the way.
See, that's what I love, though, about all these car drivers pulling over, asking for assistance. Imagine having a group of motorcycle riders just riding around, having this medical training and shows up, and now there's way too many people with medical training. I like that problem versus not having anybody with medical training. I just think the world should have more motorcycle riders with medical training. I don't know. That's just me.
All right. Okay, thank you.
Okay.
Yeah, thanks, mate. No, we're good, thank you.
And you're not allergic to any medications?
No medications, no. Just,
Ambulance is heading this
Push
way.
and align. Connect electrode.
And that's where roughly the spleen is.
You see how he even knows before even having to see things? This is what you call mechanism of injury. So he knows where the injuries might have been happening from seeing the scene, and then also from where he did his assessment and understanding this is where typically the pain is. We learn anatomy and physiology as medical professionals. So if you have just a basic idea of anatomy and physiology, you can kind of figure out, okay, well, if it hurts there, there's pain there, these are the organs there, this is the possibility. So yeah, we should definitely get you checked. He did ask about any type of medications or allergies to medications. That's very important. He's going to pass that information to the doctors at the hospital so they don't have to do this assessment again. They can get right to surgery or trauma or anything they need to do. What he's hooking up is a heart rate monitor. He did attach the blood pressure cuff. It looks like he's going to attach electrodes and then possibly a pulse oximeter, which I don't know if that's in her hand. It might be the keys. But he's getting baseline set of vitals. So once again, when it comes to asking the questions and you start to see it starts going down or up when you ask questions every 5 to 10 minutes, 15 minutes, depending on severity, what he's doing, he's getting his vitals, his baseline vitals. And this is what the standard is. Okay, now we're going to get more in 5 minutes. Is it better or worse? We're going to get more in 5 minutes. Is it better or worse? And you start to find, it's called trending. You start to find if the patient is doing better or worse, basically with this information. So when he says, ooh, that looks, that situation, that area is probably where the spleen is. So he's starting to think out loud, and he's like, we need to take you to a trauma center and possibly get surgery.
And that's the ways we have to worry about.
So that might have looked like, I don't know if he's giving any medication. It looks like quite a bit. It could be normal saline. He might be pushing through a lock, so he doesn't have a full bag attached, but he's actually opening a port. So at the hospital, if they do need to have IV access before her blood pressure drops too much, they have IV access. Because if you have collapsed veins in the hospital, it's a no bueno situation. I am really surprised they're having her stand up and walk and then sit down, especially after an injury like that and after complaining of pain, possibly a spleen injury. It might have been just the easiest way to get her onto the gurney without causing more damage. Sometimes you have to cause a little damage, cause a little problem, because if you try to do all the correct things, it could cause an issue. So this is where having experience really helps. But if you have bystander assistance training, a lot of the times the Good Samaritan law will kick in, especially if you're trying to do something within your scope of practice. And there's more about that with the training linked in the description.
Photo madness!
Sensitive photographer. Couple bumps. I'll try and make it as smooth as possible. And you get to see good old days. Go on YouTube. Go.
So that right there is the intake to the emergency room. So what this guy's going to do is talk to a nurse and get the patient a room. They've already talked on the way there over the radio or over the phone, called it in. So they should be ready to receive, especially this is an emergency situation. So they will triage and push patients away that are not severe compared to this rider. Probably why they got a room. I don't know how quickly, but they got a room quick in my eyes. Right there, what you see on the... I'm just kind of geeking out here. What you see on the bed over to the left is a slide board, basically. So what's going to happen is they're going to slide part of that underneath her, and with the sheets, that's like a plastic. With the sheets, it's just going to slide across. That way you don't have to pick up, lift over, and set down. It really helps out with heavy patients, but we're starting to find out it's just helping out with everybody because even the smallest patient can throw out a back. So it's just really cool to see. I haven't been in the hospital setting in a while, and I kind of miss it, but let's move.
Me? Yeah. A hard board's going to go under you, and we're going to slide you over to the other board.
There it is. This right here, it looks like she's going to get some MRIs or some CT scans. She's not feeling too good. That's why she's laying down. Probably her blood pressure's not the best, probably because of the blood loss that's internal. So they're actually going to check it. They're probably doing a CT, MRI, x-rays, all those things, and they're going to find that there's going to be foreign body substances inside because blood is not supposed to be sloshing around. It's supposed to be staying inside of the blood vessels. So that's what they're probably doing right there, and it looks like she was in the hospital for a week over New Year's. She's once at home recovering, all that stuff. Hopefully you're doing fine now. Hopefully your liver and everything else is taken over for that spleen that you actually had to get removed. Sorry you had to go through this, but hopefully you're doing fine. And I just wanted to share some of the insight that I have as a motorcycle coach and as an EMT that have seen these, have worked on these. I've seen the outcomes, good and bad, and that's why I'm doing this, guys. I want you guys to be safe riders. I want you to be smart riders. I want you to go to the second channel, get that fundamental training, get that on the bike training. Keep watching this channel so you can see why you need to do this, and I hope you guys just be safe, guys, okay? With that said, hope you guys ride safe, be safe, and I'll be seeing you around.